Each year around the world, 4 million children die before they reach their 5th birthday, and 1 out of 5 of those dies of a disease that could have been prevented if they had been vaccinated on time. And these are children that live in rural, remote, and hard-to-reach areas. They're the ones being left behind, even though vaccines are reaching more children than ever before. Hi, my name is Braun, and I'm the president and founder of Alma Sana, Inc. We are a nonprofit social enterprise based in Indianapolis. So I went to Cusco, Peru the summer after my sophomore year in 2009 as part of my global health studies at Cornell University. I worked at a Ministry of Health clinic and worked directly with nurses helping patients. My job was to go out and to look for these moms at their homes every day to remind them that the children were due for vaccinations. Moms not remembering their child's vaccination dates meant that the child was more vulnerable to getting vaccine-preventable disease. So I thought, what if there was just like some simple device that a mom could have on her person and remind herself of the vaccine appointments. The idea just came to me one day of using a simple bracelet, and I sketched it down quickly on a piece of paper and showed it to the nurses and said, "What do you think? Do you think this would work?" And they were so excited, and every day that week they kept coming back to me and saying, "When can we use this? Promise us you'll bring it back to us." So the way it works is that there's different numbers that represent the number of months after a child's born that they need those vaccines. And then there's also different symbols that represent different vaccines. We have a tiny hole puncher, which we use to hole punch out just the center of each shape to indicate that they've received that particular vaccine. We got a grant from the Bill and Melinda Gates Foundation, and we enrolled about 150 moms and followed them for 6 months using the bracelets. Moms overwhelmingly preferred using the bracelets as vaccine reminders compared to the government vaccine card, and they would continue using the bracelet in the future if given the opportunity.
Pienso que sí, debería seguir porque hemos visto en todas las mamás la concientización que han dado con esos brazaletes. Igualmente ha sido como un recuerdo para ellas para que puedan traerlos a sus niños puntualmente.
We already have partners lined up for Nigeria, Pakistan, and Colombia, and we're planning to follow 5,000 moms and babies for a full year. For each country, we already have both an implementation partner and an evaluation partner lined up. So this trial is the last step that we need to take before we can really scale this up. The reality is that they want to see hard evidence of how effective the bracelets are and which population the bracelets work best on before they'll commit to taking that step to scaling it. So we really want to provide them with that evidence and be able to reach more children around the world. In order to do this next study and ensure that every child, no matter where they live, has access to life-saving vaccines, we really need your support. We're offering a variety of rewards so that we can bring you along this journey with us as it's unfolding. Join us, and together let's vaccinate all the world's children.